Hi, this is Allison Bauer, and I am going to be transferring a patient to you to step down. And this is DZ. She was admitted back on the 1st for status post bone marrow biopsy, and she had a CT biopsy of her mesenteric mass in her left abdomen. And overnight, on that night, we did a bone marrow biopsy, and then when she went down for her CT biopsy overnight, she developed some increasing abdominal pain, decrease in blood pressure, and found out she had a bleed from the CT biopsy. So she went down to cath lab, had that area embolized of the mesenteric bleed. From that point, she was transferred into the ICU for hypovolemic shock. She was given some crystalloids, boluses. She got 2 of those, 3 units of Paxils, 2 units of FFP, 1 unit of FFP, 2 units of platelets, and she was actually started on a Levophed drip that night. The team actually did a very good job of getting her stabilized by the time I came in the next morning. When we came in, she was awake, she was alert, she was oriented, but she was a little on the drowsy side, considering the recent events. She's progressed very well since then, and now she's ready to be transferred out to the step down. Unfortunately, during her time while she has been with us, besides having the bleed and everything like that, her biopsy did come back, and her follicular lymphoma, which actually progressed into diffuse large cell lymphoma. We talked to her about this today, and she will be started on CHOP therapy when she comes out to you guys later on today. She is up walking in the hallways, and she is eating a normal diet. As for things that we are going to continue, we're going to continue with her regular insulin, Senna Cipro, because she is positive for a UTI, allopurinol, just because of the tumor lysis syndrome. She's going to be on the phenylglycol for stool softeners. She is on Lexapro. She does have a history of anxiety and depression. Protonix because of GERD. The saline mouthwash, just to make sure that she doesn't get any mouth sores or things like that while she's on chemotherapy. We are going to continue her PRN medications as well. Dextrose, Zofran, oxycodone for pain, and trazodone just in case she has trouble sleeping, and potassium and magnesium per protocol in case she needs those replacements. As for her CHOP therapy, she's just going to get this one time. She does know that she's going to have to come back into the office to get her round of treatment in about 3 weeks. She is stable. She is up and walking. She knows to follow up with oncology to continue that. PT and OT is going to follow her. And sometime in the near future, would like to reevaluate her echo to evaluate for some mitral regurg and to reassess her EF, because she does have a past medical history of having a MI and things like that as well. Follow up with psych as needed, just because she is taking trazodone and Lexapro. And another thing to monitor, she is going to continue her regular diet, just daily labs. And the thing that she does need to be mindful of is that NADAR will hit about day 10 to 12, between 10 and 14. We did discuss this with her at the bedside, that it's very, very, very important for her to make sure she is mindful where she is and who she's around, to make sure that she doesn't go out of the house. And if anybody comes over to visit, make sure that they wash their hands very carefully, because this is the crucial point in her chemotherapy where her white blood cell count is like absolutely nothing. And it's going to stay this way until about day 21 to day 28 from the start of her chemotherapy. And since this is new to her, we needed to stress this importance. And since she will be discharged from you guys, I know this is also part of discharge planning from you guys as well, but we also wanted to stress this on from my end as well. So good luck, and she is the sweetest person you would ever meet, and she is ready to come out and meet you. Thanks. Bye.